in right now.
First, I'd like to say thank you, Dr. Morante, for helping me pass the ANCC exam. I did take the Flex crash course, I did the question banks, and the one-on-one was super helpful, especially with the fast facts that were provided. I'd like to thank you, Dr. Morante, for being such a supportive preceptor and mentor throughout my process. Your knowledge and experience and compassion are top-notch, and I'd recommend you to anybody. So again, Dr. Morante, thank you so much for being so supportive, and I am thankful that you were my preceptor, and the classes that you provided were very informative and really helped me to pass the test. So I just wanted to say thank you.
Thank you to Dr. Morante for always being my cheerleader. His live review class was very informative, and the Q banks were hard that they honed my critical thinking skills and strategies for test taking. Dr. Morante has been very supportive, and his wisdom was always on point. Thank you for everything, Dr. Morante and PAS-NP, for helping me pass my ANCC PMHNP certification exam.
I passed! Thank you so much, Pedro Morante, for everything. For your mentorship during all of my clinical hours in my DNP program, for the PASS course that allowed me to have the confidence to excel at the PMHNP ANCC boards the very first try.
Remember your 2-2-1 rule, okay? All those questions that are difficult, sometimes they are non-scored, so don't stress about it. You should be great, and always trust the process, enjoy it. You're gonna be gonna be creating an impact to the community. Remember, it's not just to pass, but also to lead by example, to create an impact to the community. We're gonna celebrate tomorrow because you're gonna be a psych mental health nurse practitioner board certified from the Bay Area, California.
Oh my God.
Congratulations. Did you pass your board today? Wow.
The exam was very tricky. Some of the questions on your review was there. Good luck to the rest.
Yeah.
Okay, guys.
Attended our live class too in LA, right? The one in Koreatown.
Yes, I was
Okay.
in live class.
That was our live class.
For-
Congratulations. There you go. Lady Lu from California. Psych nurse practitioner board certified. So proud of you from being my student to colleague.
Thank you, Dr. Morante.
Now psych
You guys,
board practitioner.
Dr. Morante is really amazing. He lets you be very independent, and you're gonna use a lot, because not a lot of preceptors would allow you to like do hands-on with patients. And with Dr. Morante, it's like one of the best trainings I've ever had, because I learned how to create my care plan, and then just give he would give input if you're doing the right thing or not. So that was really good.
I guess we're live, huh? Hello, everyone, and welcome to all the pastors out there, the community that we started building since 2015. I would like to welcome you to a very special episode for today. It's called Red, White, and Review, July 4th edition of our past PMHNP Would You Pass Lock It In Live. And today I'm the only one that will bring in the energy for you, but I will make sure that you guys are staying engaged. So for those who are tuning in from Hawaii, Pacific, Mountain, Central, and Eastern Standard Time, thank you and welcome. Thank you for choosing me. I know you guys are driving, and some of you probably are on the plane and going to your destination for the 4th of July weekend. But thank you so much for the followers and also the messages that we've been receiving for such a good feedback. Okay, so wherever you are in the world, make sure you type in your name and where you guys are tuning in from, so I have an idea of my audience tonight. So tonight we are bringing the energy, the focus, and the board review fire as we celebrate Independence Day the past way with learning, strategy, confidence, and awesome community. I'm so excited that you are here with us for the very special event for today. Whether you're preparing for your ANCC or AANP, PMHNP board exam, reviewing key concepts, you're just in the clinicals, and strengthening your clinical reasoning, tonight is all about helping you think like the exam. So remember, we wanted to prepare you and boost your confidence in taking your board exam. This is not about memorization, okay? So remember, this is about learning how to break down your questions, identify your keywords, eliminate distractors. Remember the 2-2-1 ruling that we've been teaching you, and choosing the safest and most board appropriate answer. So tonight we'll go through board style questions, answers, rationals, and of course our secret past pearls to help you lock it in the concepts that matter. As always, we want you to participate in the chat, answer before we reveal the correct option, and explain the reasoning behind it, or listen to my rational. Remember, on the ANCC exam or ANP exam, the safest answer is often the best answer. Think about priority, safety, ethics, scope of practice, therapeutic communication, and evidence based care. So, before we begin, a quick reminder that this live review is for educational purposes only. It is not intended to replace your clinical judgment, formal coursework, or official ANCC or ANP official materials. Participation does not guarantee exam results, but our goal is to help you feel more prepared, more confident, and more strategic. So get your notes ready, drop a red, white, and blue heart in the chat, and let's celebrate the July 4th by freeing ourselves from confusion from the exam and locking in the knowledge that I'm going to share to you tonight. Welcome to Red, White, and Review July 4th edition. Let's lock it in. So let's start. Thank you for those who are tuning in once again. Let me just quickly check the chat box. Baltimore. Hi, Jan from Baltimore. And raising our Filipino flag right there. Mabuhay ka, Jan. Thank you for tuning in. And before I forget, there's a special class happening on July 7 and to July 10. It's 9 a.m. till 10 a.m. Pacific Standard Time, but this is a special class, group live masterclass touching domain 1 to 5 of the exam. So, what is that? Your scientific foundation, your advanced practice skills, your DSM 5 concepts, and also your psychotherapy and related theories. And then, of course, your ethical and legal concepts. So, those are your non clinical content areas. So, July 25, though, is 9 a.m. to 3 p.m. Pacific Standard Time. That's 1 day last minute prep. So, if you guys are attending the domain 1 to 5, and putting it all together in the 1 day last minute prep. That will be our signature pilot classes, LMP. So remember that, okay? LMP, not your last menstrual period, but last minute preparation. And you guys can scan the QR code and you will save $50 if you combine the bundle of attending both classes. And I will see you guys there on July 7 to 10 and July 25. So please hurry up while the promo code are still there, and the classes are almost full, to be honest. So please join us. All right. All right. Who else is there? Let me see. Thank you. Cruz Yudi, welcome back again. All right. And then another one will be our study tools. And a lot of you guys are requesting for this three study tools study material. We have a copy right there, physical copy. Just grab it. So I'm sorry for some of you have requested to be shipped during the 4th of July, but we had it priority mail for you guys. So we have this PMHNP Mastery. As you can see, 400 pages of like high yield psychopharmacology content areas and mnemonics. And then of course your Rise with Pass, our signature workbook for your PMHNP preparation. And then of course your PMHNP clinical concepts master field. One of the most sold out items too. I think a lot of students really find benefits in the fill in the blank section of this one. So those are our three study collections. It's available by ebook and also available also in the physical copy. So this gets sold out so fast in the past 2 weeks. So for those who are ordering right now, you have another 10% code. Thank you. And then we go to the first question of the day. So brace yourself for those who are tuning in once again. I'm Pedro Morante, PMHNP exam strategist. I've been around since 2015. This review program started during the pandemic. So I just started coaching like probably 10 students at that time, and that grew from 20, 30, 40, 50, and then 100, and then covering different states. And then I think our community right now is almost 5,000 in the Facebook and also in our Instagram. We grow our audience. So thank you so much. So this really bridged into my mission to help my kababayan who are Filipino American who are trying to make it here and be a psych nurse practitioner board certified. So, and also to all the people of color, and but also to all those who are passionate about mental health. So I'm here to coach you, mentor you, and hopefully we create a good connection and make this happen for you guys. Okay. Just a backdrop story from our review centers. Let's start with domain number one question. Okay. So let's start scientific foundation. A patient taking risperidone, also known as Risperdal, develops muscle stiffness, tremors, and restlessness. Which dopamine pathway is most associated with extrapyramidal symptoms? Is it letter A, mesolimbic pathway? Is it letter B, mesocortical pathway? Is it letter C, nigrostriatal pathway? Or letter D, tubero-infundibular pathway? So make sure you have a minute per question. And make sure you guys are not overthinking. This is a very straightforward question. You guys know this already. If you guys are listening to our Flix program and doing our question banks, this could be a very important high yield topic that you guys need to remember. And it's part of your past formula. Okay. Let's see. Okay. Let me just check in the answers. John answered letter C. Mallory Lane answered letter C. How about the rest? I have some followers here that are not answering yet. Remember, I want you guys to stay engaged and be with me for today. So take a moment, look at the symptoms. You have muscle stiffness, tremors, restlessness. What is the board trying to test you out, guys, on this question? Okay. All right. I find it hard to remember this. Okay, Cruz Yudi, I'm gonna give you a very good analogy of this. Okay, how about the rest? 1 minute per question. The maximum could be a minute and 30 seconds, but not too long. Not 5 minutes, 10 minutes, 15 minutes. You're gonna run out of time. You have to make sure you are good at timing your exam. Okay. All right. How about the rest? John, Mallory, Cruz, Yudi. All right. A lot of you dropped the heart. Remember, today is red, white, and review. Okay. Yasmet Perez So the letter C, where you guys are tuning in from? Asmet, Chris, Yudi, where you guys from? And Mallory Lane. All right. So before I reveal the answer, remember domain number one is scientific foundation. You really need to have a good understanding of your neuroanatomy, what else? Your neurotransmitters, genetics, your psychopharmacology, neuroscience, and also the brain pathways. That's very important. Okay. So there are different ways on how to remember this. Okay. So the first thing is that we're eliminating two options. Okay, what are the two options that I will definitely eliminate if I'm testing for this exam? Okay, so you're looking at mesolimbic, which is responsible for positive pathway, so or positive symptoms, I should say, of psychosis. What are examples of positive symptoms? So these are the report of the patients that they're seeing things or hearing things, or they think that they can save the earth, and they have delusions. So either they have delusions or hallucinations. That's a positive symptoms of schizophrenia. So there's mesolimbic pathway that is affected, and we have to take that out. So letter A is mesolimbic, positive symptoms, knock them off. So remember, you have four options, right? You take out one. Now you're left with three options: mesocortical, nigrostriatal, or tuberoinfundibular pathway. So as a test exam strategies, I will look at mesocortical as another distractor. So letter B is mesocortical, cut. To cut something, these are your negative symptoms. So if the patient is what having absence of speech, if the patient is having a low energy, if the patient is of course having a flat affect, or blunted affect, then that could be a negative symptoms of schizophrenia. So anything that is down or anything that is absent than usual than our baseline, then that will be your mesocortical. Okay. Now let's look at letter D. Remember from yesterday's class, I talked about tuberoinfundibular pathway. Now we're left with two options: letter C or letter D. So Charlie or Delta. Okay. So when we talk about Charlie or Delta, letter C is nigrostriatal pathway, while letter D is tuberoinfundibular pathway. From yesterday, we talked about prolactin, right? Prolactin causes gynecomastia among male. Remember, they will tell you that, oh, my breast tissue is enlarging and I'm male and I'm so bothered. And that's wherein the patient could be in long-term use of risperidone with the increase of your prolactin. And as we know, the prolactin is very important parameter if the patient can develop those symptoms. So galactorrhea for female and for male will be your gynecomastia. Tuberoinfundibular pathway. In the tube, there's hormone. Remember that. So when there's hormone in the tube, then that could be more for your gynecomastia or galactorrhea. And let's look at letter C, nigrostriatal pathway. So from the term itself, right, nigrostriatal pathway will be your keywords, will be this is involved in movement. So what are those movement? When dopamine is blocked in this pathway, especially by antipsychotic medications like our risperidone, patients can develop EPS. EPS stands for extrapyramidal symptoms. So what are the examples of EPS, guys? They could have acute dystonia. Okay. Letter B is another one is akathisia. They move a lot. So they can face back and forth. That's why we're using propranolol for that. And then they could have drug-induced Parkinsonism and tardive dyskinesia. So if we eliminate your letter A, your letter B, and letter D, then you're left with Charlie, nigrostriatal pathway. I think everybody got it correct. Round of applause for everybody, and you guys will pass the exam. Oh, welcome, Yasmet Perez from Florida. Once again, to grow our community, you can tag your bestie, your PMHNP friends. They could be an FNP taking this exam post certification, or they could be a registered nurse but interested in psychiatry. So please like, share, subscribe to our community so you get full benefit of our community. Okay. Once again, remember the keywords: movement gets stiff and slow, then that could be your extrapyramidal symptoms. So we're looking at Parkinsonism, tardive dyskinesia, and that's why we're in the dopamine pathway that is responsible for the movement is your nigrostriatal pathway. So remember the keywords, right? All right, let's go move on to question number 2. Right. Everybody is awesome today. Happy 4th of July once again. So domain 2 is advanced practice skills. So what are heavily tested on your advanced practice skills? So this is your capability to look at your screening tools. What else? For you guys to look at what will you do next for a patient that is experiencing safety concerns. And this advanced practice skills is very important. So remember, from a registered nurse, now you're thinking like a nurse practitioner. You are the provider now. So you're not just following orders, but now you have that advanced practice skills that will hone you to order labs, what else, to also treat the patients well. So it's really important that we know how to attack this particular domain. So you have a 29-year-old patient with major depressive disorder. Remember, they are presenting for a follow up visit. The patient states, I don't think I can do this anymore. The patient reports drinking heavily last night, has written goodbye messages to the family, and has access to a firearm at home. This is red flag. What is the priority action by the PMHNP? So we'll definitely highlight priority. Remember in your exam, you can flag out a question or you can highlight them. So it says there, what is the priority action by the PMHNP or psychiatric mental health nurse practitioner? So once again, domain number 2 is very important, advanced practice skills. This domain, guys, covers your assessment, clinical decision making, safety, risk assessment, therapeutic communication, and of course, your patient centered care. All right. Let me look at what are your answers, guys. Letter A: begin cognitive behavioral therapy to challenge the negative thoughts of your patient. Let's look at letter B: ask the patient to sign a no suicide contract. Let's look at letter C: initiate immediate safety measures and arrange emergency psychiatric evaluation. Or let's look at letter D: do we increase the antidepressant dosage schedule and follow up in 1 week? Do we do that? Type in your answer into the chat box. John said C, Mallory said C, Cruz UDC, Yasmet Paris C, Nicholas C, Evelyn Sanchez C. Anybody else that want to answer? Remember, this is the perfect opportunity to answer these questions because we can commit errors right now, but once we start working as a nurse practitioner, we have no space for errors. Okay, one marginal error can kill a patient or can put your license at stake. So remember that one. We really need to make sure you cover your base. All right, so let's look at this one. Okay, this patient has a high acute suicide risk because of number 1, they have a suicidal statements. Number 2, patient has substance use, which is alcohol. Remember the song of Jamie Foxx, blame it to the alcohol. So remember, the patient has substance use. Number 3, preparatory behavior. And of course, the access to lethal means, especially the most common ones is again, bang, 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 bang. So remember, you have to screen for your patient's weapons. Access to weapons, it can be a gun, it can be a knife, or it could be anything else. So anything that is contraband related, make sure that is the lethality. So the psych NP's priority is all about safety. Oh no, okay, it's all about safety. Evelyn said C. So are you guys correct with letter C? So when we look at this question, why the other answers are wrong? Let's look at letter A. Begin cognitive behavioral therapy to challenge negative thoughts. Why do you think this is incorrect? CBT may be appropriate later, but not before safety is secured. So once again, before we encourage therapy, before we tell them, oh, you have to do CBT, did we actually initiate safety? So letter A is out. A is as distractor. Then let's look at letter B. Ask the patient to sign a no suicide contract. So letter B, no suicide contracts are not considered adequate protection and do not replace risk management. So letter B is also a distractor. So make sure A is out, B is out, then we're choosing between letter C or letter D. Okay. Now, a most common error of students is that when they take their exam, they can't eliminate two options, right? Already obvious to distractors. But once it comes to choosing between two options, it can be challenging. So this is wherein I tell my students the power of leverage. What is leverage? When you like an apple, but you also like orange, you can have both, right? You have to choose somebody, or you have to choose either an apple or an orange. So, what does it mean by that? The power of leveraging. Which one is your favorite? Or we could choose what, would you like BTS or would you like Blackpink? Now, that's a power also of leverage. Just choose one. So what I'm telling you guys is sometimes you are in the testing center and you're choosing two options, and sometimes you could be, oh my god, I like letter B, but it seems like letter C, but it seems like letter B, but it seems like letter C. Then that's a board trap. You need to make sure you're decisive, and you need to make sure you can choose a response that is appropriate for the question. You can't be flaky, or you can't be like impulsive, or you can't be, well, oh, I like this answer. It seems like but letter C seems correct. No, you have to be firm. The same thing, right? When you're choosing a wife or a husband, you need to make sure, is it beauty or brains? Can I have both? No. If you're testing beauty or brains, or money or love, something like that, right? So you really need to be firm with your options. So what is the answer here? All right, let's reveal the answer. Answer is safety. So remember, this patient is high suicide risk. So we're looking at the patient has a plan, the patient has a means, and they're telling you they're gonna have a goodbye letter, and then they're also intoxicated. Remember, blame it to the alcohol. They're intoxicated. That's high risk for your patient. So when risk is acute, choose the answer that protects safety now, not the answers that delays the care. So once again, initiate immediate safety measures and arrange emergency psychiatric evaluation. Great job, everyone. Any questions? Are you guys learning from this platform? Watch out for September. We're launching another in-person review. I cannot wait to share that to you guys. But we decided to do an in-person review because a lot of students are asking, we want to see you live. We want to see you in person. So we're giving you an opportunity to see us on September. Okay. So make sure, save your calendar. It's going to be a weekend, either a Saturday or Sunday or both. So we're doing the logistics right now. So please make sure, stay tuned. Let's go to question number 3. All right. Thank you. The next one is domain number 3. This is your diagnosis and treatment. So remember yesterday, Professor Lady and I went over DSM-5. So it's very important that number 1, as a clinician, you need to make sure you know how to diagnose, because that's part of your scope of practice. You can't just be, oh, this is ASD, oh, this is schizoaffective, oh, it's probably something else. You really need to make sure you know your differential diagnosis and you know your final diagnosis. But it takes a lot of skills to do this. And the more you practice, the more you talk to your patient, the more you get collateral data, the more that you're going to arrive at the best diagnosis for your patient. So look at the history, right? Make sure to give a thorough interview, especially on your initial patient. So 1 hour to 1 hour and a half could be a good optimal intake. That will be ideal. Sometimes we can go over for 2 hours just to get to know the patient really well, especially in our first appointment. So a 26-year-old patient reports decreased need for sleep, pressured speech, impulsive spending, grandiosity, and increased goal-directed activity for 8 days. That's a lot, right? Symptoms cause significant impairment. What is the most likely diagnosis? And we're following the DSM-5 criteria. Okay, letter A, is this a hypomanic episode? Letter B, is this a manic episode? Letter C, is this cyclothymic disorder? Or letter D, is this major depressive disorder with mixed features? Okay, So remember, when we talk about domain number three, we're focusing on diagnosis and treatment. It will test you on your psychiatric diagnosis, applying your DSM-5 TR criteria, selecting a treatment, monitoring medications, and managing symptoms correctly and safely. All right. So let's look at your answers. Let me look at the chat box. Okay, Jonita B. I'm seeing a lot of banana. So is it Alpha, Beta, Charlie, Delta? A lot of letter B, Beta, or banana. Bananas and pajamas. All right, so let's look at that. How about the rest? Thank you, Sandy Shavers. Where are you guys coming from? Mallory Lane, where are you guys coming from? Evelyn, Yasmet, Junaidi, Cruz, Addie, where are you guys coming from? Happy 4th. All right, so let's do your 2-to-1 ruling, okay? Remember your patient, looking at your patient, this is lasting for at least 1 week or any duration if hospitalization is required, and also causes marked impairment that involves psychosis or may require hospitalization. So if you look at the options, right, if you have a manic symptoms, usually they have a decreased need for sleep, they have a pressured speech, they talk a lot, and they're so impulsive. They could have a one night stand with 10 guys in the bar or 20 sexual encounter at that time. Yeah, they could be very impulsive, grandiose. They can think that they are a superhero or something. Or they could have a lot of like increased goal directed activity. So the symptoms lasted 8 days and it has caused significant impairment. So what is this? Remember, what did we teach you from yesterday? Two opposing options could be the right answer. So let's take out letter C and letter D and let's choose between A and B. So letter A is hypomanic episode. Hypomanic, guys, it lasts for 4 days. So remember that. But it does not cause marked impairment, psychosis, or hospitalization. While your mania, guys, remember it lasted 8 days and can cause significant impairment. Why not letter C? Cyclothymic. Cyclothymic, guys, involves chronic mood fluctuations with hypomania and depressive symptoms, but it does not meet a full criteria for mania or major depression. So letter C is out. Why not letter D? Remember your major depressive disorder with mixed features, they will require you to have manic or hypomanic symptoms. But this question is directly relating to a full-blown mania. So what are the medications that can cause mania, guys? You have your steroids, which are very important for your exam. Anything that ends with zones, hydrocortisone, methylprednisolone, uh, these medications can cause you to have mania. What else? SSRIs and you have bipolar disorder. It can induce mania too. So we need to screen for those medications. Okay. Make sure that they're not taking those and make sure that you are assessing them correctly. So what is your answer? Let's rebuild the answer. Answer, lock it in. A manic episode at least 1 week or requiring hospitalization. That is marked impairment, psychosis, and hospitalization is your full-blown mania. So hypomania at least 4 days. So hypomania, 4 syllables. Hypomania, 4 syllables, 4 days. That's how I remember it from my end. But you can do your own mnemonics. Mania, you have a severe, unsafe, impaired, or psychotic. That's your keywords. While hypomania, you have your noticeable but not severely impaired. So remember that for your board exam, mania versus hypomania. Oh, great job, everyone. So we have somebody from Illinois. I love Chicago, Illinois. We have somebody from Miami. Oh, love Miami. Florida United. Which part of Florida? And we have Iowa from Cruz UD. Alabama. Ooh. And then we also have Mallory Lane. Where you coming from? Or Illinois. Hypo 4. HYPO. 4 letters. I love Mallory's Lane's mnemonics. HYPO, 4 syllables. Hypomania. Hypomania, 4 syllables. Houston for G's and Noel. Oh, shout out to Texas. I love Texas. And then we have Indiana at 80. Okay. Welcome. Happy 4th of July. So we're done with 3 domains. We're going to move on to the next domain. Let's take it away. Thank you. Fort Lauderdale. Oh, I think I remember being in Fort Lauderdale. We went there going to the cruise, going to the Bahamas. So I've been to Fort Lauderdale. Okay. Let's look at your domain number 4, psychotherapy and related theories. Okay. So what is your focus on this one? You want to focus on your psychotherapy modalities. So this domain will focus on your therapy modalities, counseling techniques. It will also focus on therapeutic communication, behavior change, and theoretical frameworks. Okay. So this is a patient with panic disorder avoids driving because they fear having another panic attack. The PMHNP gradually helps the patient practice driving short distances while using coping skills. Which therapy technique is being used by this patient? So is it letter A, free association? Is it letter B, exposure therapy? Is it letter C, dream association or dream interpretation? Or is it letter D, motivational interviewing? Great job, everyone. Anybody from California? It's just me for today. I guess the Californians are out and about. So if ever you guys are in California on September, once again, we're gonna have a in-person class. Watch out for that. It's gonna be amazing. We've been doing it since last year, and we have great turnout. We did it June last year, and we're gonna do it September this year. The weather's gonna be nice in LA for sure. Okay, type in your answer into the chat box. All right, letter B, letter B, letter B. A lot of bananas. So is it Alpha, Beta, Charlie, or Delta? Remember, what is 3 months of review versus a lifetime? You got this, everyone. 3 months to study, 90 days. The sooner you start the program, the better. Remember, perfect practice equals perfect performance on the exam. Okay, remember that. Perfect practice makes it perfect. Letter B, letter B, letter B. How about the rest? Okay, let's look at your options, guys. Your keyword here is which therapy technique is being used. Am I correct? So you're looking at the positive answer or an affirmative answer. So exposure therapy, remember, by definition, gradually and safely exposes the patient to feared situations so the brain can learn that the feared situation is not actually dangerous. So in this question, the patient, your keywords there, guys, right? The patient avoids driving because they fear having another panic attack. So I have a friend that is also fearful about driving on the freeway, and she is taking some medication like propranolol before driving on the freeway. And it's really the perceived threat. They feel like, oh, there's an elephant on their chest, or there's like what, a butterfly on their chest when they're driving on the freeway, especially in LA. It's a lot of traffic. So the PMHNP helps the patient gradually practice driving short distances while coping skills. So that is letter B, exposure. You guys are correct. So exposure therapy, where do we use exposure therapy, guys? We use this for OCD. We use this for PTSD. We use this for panic disorder. Your free association therapy will focus on psychoanalytic therapy. So that's wherein your Sigmund Freud therapy goes. And your dream interpretation. Remember the father of psychoanalytic theory, Sigmund Freud. I remember the theory OA palagi. In Filipino, overacting always. OA palagi. O stands for oral. A, anal. Fa, phallic stage. La, latency. And then ge, genital. So OA palagi. So for those non-Filipinos out here, you remember OA palagi for your psychoanalytic theory by Sigmund Freud. Oral, anal, phallic, latency, genital. Remember that. So if your toddler is trying to play with his genitals, it's part of like your phallic stage. So if they're playing away, playing with their genitals or they're touching their genitals, you have to tell the mom it's probably a part of the phallic stage and there's nothing to be worried about. Not unless you think that there's like sexual abuse, then you need to report it. So remember, the psychoanalytic theory or psychotherapy is part of your exam, and you really need to break it down, and you really need to understand how the exam works. So for the board exam, when you see gradual practice, think about feared situation. When you think about motivational interviewing, can we go back to the previous slide? Motivational interviewing is used to explore ambivalence and support behavior change, especially in substance use and lifestyle change. So, letter D is substance use or lifestyle change. Letter A and letter C are the same. When there are two options that are similar or the same, take them off. They're not the best answer. So, exposure, if you're exposing your patient to their feared object, so you are doing a gradual desensitization, and this is very effective for phobia. So very typical example, I fear like heights. So you need to show your patient like pictures of like what heights, and then they will be able to ride in the elevator slowly. Show them a picture of the elevator, then take them to the elevator, allow them to press the switch of the elevator and then allow them to ride. So slow transition. You just don't flood them. Flooding means, okay, you fear elevator, let's ride in the elevator. So that's what you call flooding. When you say gradual desensitization, you're exposing them step by step, showing them a picture, having them touch the door and riding in the elevator. So that is gradual desensitization versus flooding. Okay. And I discussed that also in our PMHNP on demand Flix program. All right. Let's do question number 5. Oh my God. We did 4 questions. And now we're doing number 5 questions. The last but not the least. All right. So we're looking at ethical and legal principles. This is basically some of the questions that, oh, I'm so good at clinical, but when it comes to non clinical, sometimes students struggle because they don't pay attention during their program or they feel like they know it by heart already. But there are certain guidelines or certain ethical issues and legal principles that we need to remember when we're testing for the board. It could be our duty to warn the third party when somebody is about to kill somebody. So if a patient tells you I'm gonna hit somebody with with uh with a knife tonight after going home, then you need to make sure you involve the police. Or your boyfriend tells you I'm gonna commit suicide tonight, my dear, then you have to involve the police. Okay, call the police and make sure that they are kept safe and they are on monitoring program. So this domain will test you the understanding of confidentiality, the duty to warn, informed consent, patient rights, scope of practice, documentation, mandated reporting, and ethical decision making. So here's question number 5. A patient tells the PsycNP, I am going to kill my coworker tomorrow. I know where he parks. Oh my God. What is the PMHNP's first priority action? So when you're working as a new grad and somebody tells you this, what should be your priority? Is it letter A, maintain confidentiality? What does it mean by that? Just zip your mouth and say nothing. Is that therapeutic? Is that safe? Letter B, document the statement and reassess next visit. Remember? Do we do that? Or letter C, do we warn and protect the identifiable victim and notify the appropriate authorities? Or do we do letter D, encourage the patient to use relaxation techniques? All right, let's look at your answers. Wow, okay. A lot of you answered Charlie. John says Charlie. Baltimore, Addie says letter C. Indy said C. Florida said C. Iowa said C. Charlie, Charlie. Fort Lauderdale said C. Shasta, C. Mallory, C. Evelyn, C. Tarasov. Okay, are you guys correct with that? So once again, we are here for you, and we always want to make sure that you guys understand the content area. We simplify things out for you and coach you to be the best psych NP out there. But the first initial step is to pass the boards, okay? Because doors will open up after you pass the boards. Okay, your keywords is priority action. Okay, so let's look at priority action. This question is actually looking at the direct and credible threat toward an identifiable person. So the patient made a direct, credible threat. They're gonna kill somebody tomorrow. Who is the coworker? Probably that coworker is not so favorite of the patient. The PMHNP must take immediate action. This will be your immediate safety question. This may include notifying the law enforcement, warning the potential victim by tires of law, and arranging emergency evaluation or hospitalization, and documenting the threat and actions taken by the patient. So confidentiality is important. Letter A is important, but it has limits when there is a serious risk of harm to others or to self. Remember that. Letter B, documenting alone is not enough. Reassessing next visit is very unsafe. Relaxation techniques, which is letter D, does not address immediate threat. So what is the answer? Let's reveal the answer. So once again, confidentiality has limits when there is a risk for serious harm. So when there's a danger and there's an identifiable victim, it is our duty to protect the patient. So for the board exam, when you see a credible threat toward a specific person, the answer is not maintain confidentiality. Another example is that I'm going to commit suicide tonight. Please let's keep this as a secret. It's never going to be a Victoria's secret between you and the patient, right? You need to make sure you tell Victoria, I'm not going to keep this as a secret. You're suicidal, you're homicidal. I need to make sure to do my safety protocols. Okay? You cannot keep a secret to your patient like that. Okay? Anything that is abuse, anything that is what? Homicidal, suicidal ideation, there's no Victoria's secret out here. You need to make sure you provide safety precautions. Okay? Very good, everyone. Oh my God. Evelyn said Tarasov. Very good. Tarasov or the duty to warn the third party. So let's recap. Great job, everyone. Tonight we covered all 5 PMHNP domains. We started with scientific foundation. We reviewed the nigrostriatal pathway, which is also known as for your pathway for your EPS. Your domain 2, advanced practice skills. We reviewed suicide risk assessment, right? Domain number 3 is diagnosis and treatment. We reviewed mania versus hypomania. Domain number 4, we did psychotherapy and related theories. We reviewed exposure therapy in comparison with phobia, or or in relation to phobia, in comparison with dream association and also your CBT. Domain number 5, we talk about ethical and legal principles. We reviewed duty to protect when there is a credible threat toward an identifiable victim. So once again, let's do a recap. EPS equals blank. Everybody that is tuning in to the chat box, EPS equals blank. EPS equals the letter N and the letter P. Once again, type it into the chat box. We're summarizing everything. EPS equals blank. The initial is NP. So type in your answer into the chat box. That will be your what pathway. EPS once again is what pathway. Let's do this, guys. Let's do this. EPS equals NP. What is NP? Wiki wiki. I think they need coffee. They need coffee. Everybody needs a shot of coffee. So NP stands for nigrostriatal pathway. Very good. Now, let's talk about your domain number 2. What did we learn from domain number 2? Domain number 2, suicide concern. What will we do? I will type it into the chat box. Suicide concern, what do? We need to ask directly. Okay?
Mania. What do we mean by mania? Mania is what? 1 week or 7 days plus impairment, such as psychosis, hospitalization, or unsafe behavior. Avoidance anxiety, you need exposure therapy. And threat to identifiable victim, towers of law, duty to protect. All right. Thank you for joining Red, White, and Review. Keep thinking like the board exam, guys. Okay? And just to make sure you sign up for our classes, July 7 to 10. This is online, on live. So you have a coach, PMHNP coach. In that classroom, we will go over domain 1 to 5, almost similar to what we're doing right now, but I'm going to give you a very good review out there for domain 1 to 5. And then PMHNP 1 day LMP. Once again, LMP. Last minute prep. Don't think about that one. July 25, 9 a.m. to 3 p.m. Pacific Standard Time. There's a sale today, July 4th. Save $50 if you scan the QR code, and we'll be happy to coach you. And we want to make sure that you pass. So, and also our study collection is throwing out there your clinical concepts, your psychopharmacology, and also your Rise with Pass. Scan the QR code and you'll get a 10% off for these 3 books. So PMHNP Mastery on its own, and then the other books. And then, of course, we started our program once again 2015. So this will be our 10th year serving you guys, especially the past community. So we originated from Morante and Associates Training Center, and now it's PASS. So your one-stop shop courses to pass your exam. So what do we offer, guys? We have PMHNP review. We have FNP, AGNP, ANCC, and AANP review. We have NCLEX Next Generation, RN, and LPN review. We're currently partnered with University of Luzon. So we're doing their in-house review for their NLE and NCLEX. And then we have your live masterclass also. We have your on-demand crash courses, question banks, one-on-one last-minute prep, continuing education units, approved by BRN, BBNPT, IV therapy and blood withdrawal course for LVNs, first aid training, BLS, ACLS, PULSE, ASLS. So the whole shebang. We want to make sure that we serve all of you. And if you have a friend that would like to join our past community, please make sure to tag them, like, and share and subscribe. And why will you use PASS? We have an expert-led courses, up-to-date courses, high pass rates, and of course, we have flexible and self-paced study modules, the support that you really need. Of course. Since 2015, yes, Chris UD. So if you track, we used to be called Morante and Associates Training Center. How long have you been doing these lives on social media? Wow. Okay, 1 month. Before though, I used to do it in a different platform, but now we're doing like 4 weeks. So I think at the right time and at the right timing, some of you said it's a perfect timing for you guys to encounter us in social media. So please like, share, subscribe, and grow our community. The only way that we can do this is with your support. Okay. Yes, we've been around since 2015. Can you believe that? Okay. How long have you been a provider? Okay, so initially I've been a FNP. So I graduated 2015 and I did family practice, I did geropsychiatry, I did internal medicine, and also geriatrics. And then I switched over to psychiatry because I really wanted to serve my community, Filipino American community, and also the people back home in the Philippines who are struggling with mental health. So I also have a podcast, Mindful Moments. So I was a Psych NP with DNP program. It's called Bremen University. Now they're called UMass Global. So I did DNP. So total 2015 and now it's 2026. So almost 11 year as a provider. So I've been mentoring students and I've been precepting students too. So if you guys are so much welcome to our clinic. We are student friendly and we have hands-on program for our students. Okay. Junaida, feel free to join our mentorship program if you have to. So after you pass your exam, some of the students I have mentored and also precepted, uh, in total probably 40,000 and counting. Yeah, in total of 11 years as a nurse practitioner. Okay. All right. Once again, that will be the end. Any other questions before I go? Thank you, Junaidi, and thank you for always joining us. Yes, and happy 4th of July. So I'm gonna do my greeting to my wife and to my kids out there. Okay, they've been very supportive of this. Especially my wife has been the director, making sure that we deliver this best care for you. So thank you so much for showing up, participating, and answering questions, and staying committed to your PMHNP board prep journey. Tonight, we reviewed more than just facts. We practiced how to think through the ANCC and ANP style questions with safety, prioritization, and clinical judgment in mind. As you continue preparing, remember this exam is not only testing what you know, it is testing how you think as a future psychiatric mental health nurse practitioner. When you feel stuck, come back to us, come back to the basics. Safety first, least restrictive care, what else? Therapeutic communication, scope of practice, ethics, evidence based treatment, and always read what the question is really asking. You are not just studying for the exam, you are preparing for a real patients, real families, and real communities. That purpose matters. So tonight, guys, as we celebrate July 3rd and July 4th, remember that your journey always represents freedom. Freedom from fear, freedom from doubt, and freedom to step fully into your role as a confident psychiatric mental health nurse practitioner provider. And then from all of us here at Pass Review, thank you for joining us. Stay focused, stay encouraged, and also keep showing up for your dream. Enjoy your 4th of July. Stay safe, and we'll see you at the next Lock It In Live. This is Red, White Review. And as always, lock it in. I can also support you with your mentorship program later on. So please stay tuned for more updates and more classes. Thank you, pastors. I love you all. Bye. Let's end this